Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program focuses on different healthcare issues relevant to you and your family members. I've got a really exciting guest for the show today, so I hope you stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Sue Kern. She's the emergency coordinator amongst everything else. There's a lot of hats you wear, Sue, but I'm so glad you're on the show today.
Well, thank you for having me.
Because I know we have a bunch of things to talk about because there's so many different things, as I mentioned, that you're involved with. But first, Sue Kern, I know you're related to my Scott Kern that works for me, but how long have you guys been in Kingman? Long time, right?
For a long time. First time in 75. I worked here as an ERRN in 75. Got married, we moved to Globe where my husband was a DPS officer, and we came back in 81, and I've been here ever since.
Okay.
So 1981.
So you've seen a lot of changes both in the community and at KRMC.
Oh yes. Yes.
Lots of growth, lots of development, added new services here at the hospital. And I know you've been really instrumental in the ER side of things, emergency room, both in our trauma center, the different levels as we've progressed. We were talking before the show that we used to be a level 5. That's like your
4.
4. Oh, so
we are a level 4.
Oh, we are. But didn't we start as a level 5? Or
No, level 4 is the lowest.
Oh, okay. Sorry. Then I'm glad you clarified that. So we started at level 4, and now we're getting ready to apply for the level 3. And there's a lot of things involved to make that happen. You have to have certain types of docs, right?
Correct.
Certain physicians being able to provide certain levels
of care.
So that's a big process that we have to go through. What else?
It is. Level 4 is basically accredited by the state of Arizona.
Okay.
And they have certain criteria that we have met. And level 3 is accredited by a national organization called ACS, the American College of Surgeons.
Okay.
So they actually, we apply to them 5 months ahead of time, and then they send a crew from some other place in the country and come in. State of Arizona also needs to be notified, and they also come. So then the state is aware of what we're doing.
Okay.
But as we up our level of trauma care, with each level. So level 4 is your very beginning trauma center, where we formed a trauma team.
Right.
And we actually call activations overhead. So if you're in a wreck and the paramedics patch, then the unit coordinator and the clinical leads notify the physicians and the team, and when you hit the door, we have a room and a crew, x-ray, lab, the doctors, the residents, the nurses, respiratory therapy lab. Everybody's right there, swoops down, does their thing for stabilization.
Wow. Okay.
So, and that's, the minimum. So now as we progress to a level 3, there's more criteria we must meet. We break out our activations to a level 1 or a level 2. Level 1 is a critical patient. Level 2 is a patient that is not as sick, not as hurt. But we have, with the level 1 activations, surgeons there within 30 minutes of activating, so that they're notified by beeper to be there. So we have a team that meets monthly. All of the players meet and we sit down, and it's called Performance Improvement Committee. We look at some of our cases, what have we done that we can do better, what have we done well, and where are we going to go in the future. So it's pretty exciting. We have really improved patient trauma care here.
Well, that's awesome, and that also means then that more of them get to stay here.
Correct.
Versus being shipped
it's a huge burden to the families when we have to fly everybody to Vegas.
Sure.
Because they have to drive, they have to find a place to stay. If we can keep them here, it's so much better.
Absolutely.
So,
for both the patient and the family.
That's right. And our surgeons are providing excellent care for the trauma. So our nurses have extra trauma training in the ICU, in the ER, and the OR. We've sent them to trauma nurse school, basically. They spent 2 days going through how to become a trauma nurse and what to look for and how to do it. So we've got all those things done. Everybody in our ER has to have, it's called TNCC, Trauma Nurse Core Curriculum. and certain key people in the OR and then certain key people in the ICU, all those nurses also have it so that we
Okay.
can manage the trauma patients.
Okay, so that makes, so again, it's that team approach.
Right.
But it's a step up as far as the basic training that
Right,
each
that,
of those
that all nurses
individuals
have, right,
So it's over and above that.
correct.
So that's just one, I mean, it's a big piece of what you're doing right now, but you also wear a couple of other hats
Right.
in the emergency room. What was the other two?
My main job is I'm the EMS manager, Emergency Medical Services Manager, and I work with Dr. Ward, my medical director, and we take care of the paramedics and the EMTs.
Oh, okay.
Okay, so we make sure that when they run a call, we look at it, make sure everything's done correctly. We do their training. I've taught paramedic classes off and on for 30 years. We have meetings monthly at the Elks, and we sit down and we review calls. We look at new things that are happening in the country and make sure that we're meeting that level of care.
Okay.
Right now we're working on transmitting 12-lead EKGs.
What does that mean?
That means that if you're having chest pain in the community, the paramedics all have the ability to look at multiple sides of your heart, not just with like a 3-lead monitor,
okay.
but we can look at all of sides of your heart to see if you're having a heart attack. And right now, Kingman Fire, so in the city, if you're in the city, they can transmit the 12-lead to the ER doctor.
Oh.
So even before you hit the door, the doctor can look and say,
Knows what he's got
call the
coming.
cath lab, because our goal is for people that are having heart attacks to get you to the cath lab to open up any closed vessels.
Right.
The other fire departments, Northern Arizona, Golden Valley, the ambulance, Peach Springs, they're getting ready to transmit. They all have the capability of doing 12 leads, but they're working with our IT department, and they will soon all be able to do the transmit. So that's our big project this couple of months. So we've been working on that.
That's really, I would imagine, helps for the patient survival rate.
Exactly.
Obviously.
And I do the studies every month for MIs to see how quickly we get to the patients with chest pain. So if you're having chest pain, you need to call 911.
Right.
Because if you call 911, they have the ability to put the 12 lead on, call us ahead of time, we can clear a room, get the doctor and the cath lab ready. Most people come in by private vehicle and they sign into triage, and if they have multiple complaints, they may not be seen as quickly as those people that have called 911.
Sure.
So we statistically have a significant difference, especially at the busier times of the day in the evening. Those people that walk in don't get seen as rapidly. And our goal for any patient, no matter whether they come in by ambulance or if they walk in, is to get them to the cath lab less than 60 minutes to the ER, because the cath lab has a 90-minute goal to open their arteries.
Right.
But we like to do it. We've had some as short as 7 minutes.
7? Wow.
Yeah, so, I mean, we do it really fast.
That's almost as fast as it gets from ER to the cath lab.
No kidding. we have some very short
That's
transport
awesome.
times, yeah, especially if the cath lab's there.
Right, yeah, if they're already there in the middle of the day or whatever.
Yeah.
That's really cool. That's awesome. So then there's the third hat you wear, the
And
emergency preparedness.
They used to call it disaster. I used to be the disaster coordinator, but the term scared people after 9/11. We used to have disaster meetings, but now they call it community preparedness. So my job at the hospital is to make sure that we are prepared for any emergency, that we have adequate supplies, that our people are trained, that we have a process in place that we can call upon during a disaster. And the national disaster policy is called HECS, Hospital Incident Command System.
Okay.
It comes from the military, and what they noticed after 9/11 was the fire departments all functioned very well together because they understood to use this unified command system.
all work
And
as
it's like a pyramid thing where they have a chief, and then there's 4 section chiefs, and each section chief has jobs, and he gives those people jobs, and it just kind of branches out. But the hospitals didn't have that at the time, so they all were doing their own thing, where the fire departments and EMS had this unified way of they were doing it. So after that, the federal government started having all hospitals use incident command system.
Okay.
So if I left here and went to Las Vegas to work, I would know how to work in their disaster should one occur, because they would use the same system we use.
Oh, see, I didn't know that. I mean, I've been involved in our disaster teams as our, what do we call it, our trial, no. There's some name for it, that when we have those practices.
Our
mock-ups.
Yeah.
And, but I didn't realize that we were all across the country kind of
Yes,
using
I
the
mean,
same
each
system.
hospital has some individual things that they may do, but overall the system's the same. We have an incident commander, a planning chief, a logistics chief, you know,
And that makes
financial
sense.
chief, and an operationals
Sure.
chief. So, you know, Brian, if he were here as our CEO, would be the incident commander, and then he would assign 4 chiefs, and those chiefs would assign things that they needed done. So the planning chief would look and see, this is your job, and it's all spelled out. He'd, you know, and he would say, make sure there's adequate food. So he would then call nutrition services and talk to Robin, and this is what's going on. Do you have enough of this? And she would look and say, oh, I need 3 people under me to make sure there's water, that there's this, that there's that. So it just kind of breaks down that way.
That's
So,
great. Well, and it makes sense when you think about it from if a true disaster, and that if I happen to be traveling as a nurse, you know, and I'm in a community that I can step in and help, that I'll know and be able to help because I've got that same system in place
Right.
at my hospital.
Right.
That makes a lot of sense. Or if, like you said, if you move and go somewhere else, kind of thing. Well, I know I've been involved in some of those mock trials we've done, and it's very interesting. And I think, you know, we'll talk more about that because there's a lot of details that go into that planning.
There is.
And there's a lot of different kinds of disasters. You know, I mean, were you here in the 70s when we had the propane?
I was still in high school then. I'm not quite
Okay,
that old, Jamie.
That's why you said 80s when you were here.
Actually, I was a senior in high school, and I came 2 years later. I went to nursing school and then came here in 1975. And our ER at the time, as a result of that Blevy, that Doxol Blevy, had our trauma room was lined with sterile linens and sheets, and they were like waiting for it to happen again, like it wasn't gonna, we weren't gonna get caught without it happening again, and it stayed there for a long, long time.
Okay, we want to talk more about that. We're going to take a quick break, and we'll be back right after these messages, and we'll learn more. Welcome back to Your Health Matters. My guest today is Sue Kern. Thanks for being on the show, Sue.
Thanks for having me.
I always learn something new, and I'm learning a lot here today. When we were talking before the break about the different types of disasters, and of course, for those that have been in Kingman for a long time, they always talk about and remember the Doxol, what did you call it?
I called it a Blevy.
Blevy, when the propane explosion, and of course that impacted this community
Tremendously,
so
yes.
hugely. And I know that that particular incident is used across the country in training. My brother is a volunteer fireman in Minnesota, and he saw a video that used that as an example of kind of what not to do, if you would, at that time.
Right, exactly. That's what it is. That's what they use it for, what not to do.
Yeah.
If they had just left it alone and left it burn, it would have been okay. We wouldn't have lost all those people.
Wow. That's
So it's an
sad.
unfortunate lesson,
Right.
but they do use it in hazmat training to show them what not to do.
Yeah. So that's just one type of disaster, obviously, that majorly impacted our community and our hospital, because we had a huge number of people brought in with various levels
of burns, yes,
and
yes.
injuries from it. But there's lots of other types of disasters that we could have. And sometimes I think people think disaster is like, you know, the end of the world, but it's not that necessarily big that we're talking about, because it's smaller emergencies that can happen, whether it's someone traveling that's bringing a very contagious disease. We've done drills with that, because that's what we do. We do drilling, practicing to make sure that we're ready, right?
Right. We try to think of all the scenarios that could happen to us and identify what we can do to prevent it. We don't do it alone. We do it as part of the community. Kingman Fire is very involved in the city, and then the county fire departments, the ambulances are involved. We have a local emergency planning committee that I sit on, and Byron Stewart, he runs that. And we sit down with both public and private sector, and we discuss not only Kingman but the whole county.
Sure.
And we can share resources and who has what and what happened in the county and what could happen in the county, and sort of plan for that. So yes, we're very aware of some of the things that can happen. We're safe in many areas as far as, like, we're not a hurricane issue. It's not we're a tornado haven. Did you know that? We're actually considered a tornado haven.
What does that mean?
That means that we almost have no tornadoes.
We have high winds.
High winds, but no tornadoes. Although I have seen one or two hit the Wallapies, but we have so little that we're considered a haven. Earthquakes, there's a fault under Peach Springs, but we're not a high earthquake area. So we have very few natural disaster type of situations to worry about, other than sometimes, as everyone knows, our 40-mile gale force winds type thing. Our biggest concerns are if something happens in LA or Las Vegas, the exit routes come through Kingman.
Because of Interstate 40 and 93.
Right, that type of thing. So we could have large amounts of people taking all of our resources. In a true emergency, we only have enough food in the grocery stores for one day.
Really?
Right. That's why...
Because we've gotten so dependent on the constant flow of transportation.
Because trucks can travel back and forth, so everything is delivered daily. So you don't really think about it. But County Health several years ago put a huge campaign on public personal responsibility and tried to get people to have a 2-week supply of food, medicines, and water in their home.
Right, I remember the radio commercials for that.
For that very reason, that we don't stockpile a whole lot in town because we're a small community. So that's a concern. If something came through I-40, if somebody came in with, like you talked about earlier, with a bad type of bug of some kind, and
we go into quarantine,
that type of thing. We had bird flu, or H1N1 was a big thing several years ago. You know, we work with County Health to identify, to get the vaccines out, to get those type of things under control early, how to transport people, how to get the people to the vaccines, or should we get the vaccines to the people so we don't have large groups of people milling around trying to get, vaccination. Should the fire department go to their homes? We looked at that, borrow the city buses.
Where you put them when they get sick, because if we overflowed the hospital, where I remember we talked about that, whether we use the gymnasium or the hotels, just looking at the whole picture.
Having to look at, and once even if we have buildings, do we have the nurses or the people to take care of the sick? And if you remember the 1917 flu, they would show you rows and rows and rows of people in cots, with 2 or 3 healthcare providers trying to care for them. So that was, of course, a very scary thing. We don't want to repeat that, but that's something we look at on a regular basis. County Health, that's a big concern for them. The other thing we have is all of our trucks and trains. Again, the levee that occurred, but we have lots of hazardous materials, what hazmat is, coming through town on trucks, as well as the rails. So because we're on I-40, that's always a concern. Nuclear waste are a concern. Most people don't think about it, but we see a lot of that stuff come through Kingman every single day.
Yeah, because it's on the freeway. They're like I said, on the trucks or on the trains.
Right, so it comes through on a regular basis.
So those are just all things to be prepared for. So I know that, for instance, we have a whole supply area of extra bed cots.
We have a disaster trailer outside of our ER that I bought with HRSA money, with federal money that I got through the state. We participate in all of their drills and all of their meetings, and they give us some funding, and we purchased a trailer to keep extra supplies and cots and equipment and those types of things in there, so that it's readily accessible to the ER, so that they could get it in a timely manner should something happen. We've got a decontamination tent.
That's right.
That we can set up, and we practice setting it up. Our plant op sets it up 2 or 3 times a year, and they get it up pretty quick.
Good.
And we usually put it in front of the ER, and then the ambulance are like, "Where are we going to park, Sue?" All right, figure it out. The other thing we have is the Olympic pool. And one of the big worries is if you have to decontaminate large amounts of people. Very few hospitals have an Olympic pool. We can actually decontaminate the entire county in there if we had to. if we
Wow,
had to.
I didn't realize that, the
Yeah.
whole county. That's a lot of people.
It will actually decontaminate like 130,000 people.
Huh.
If we had to, without having to change the water, if we have a big
So it's like-
chemical,
I was gonna say,
it's
you put
like
something-
a chemical, organic phosphate poisoning type
Okay,
thing. Yeah.
okay.
So it would maybe be a nightmare, but we
Right.
could probably
But we could do it.
We could do
Right.
it. We could get it
Yeah.
done. So we have looked at that. The fire department's looked at it with me. So we've kind of looked and talked about that with, where do you stage the ambulances? How do you get the patients from here back to the ER? Should we keep them here? But we look at all of those aspects of everything on our campus, what we have available, how we can flex to meet the patient's needs in large quantities. And that's the whole thing with any kind of a disaster plan, is to keep it simple and to keep it flexible.
Right.
So
I was just going to say that flexibility is probably one of the most key parts of
Right,
success,
right,
is
exactly.
because you don't know
Right, and
until
don't
it
be afraid
happens.
to think outside the box,
Yeah.
those types of things.
Yeah.
So, those are one of the things that I usually try to look at ahead of time is, how can we do it? How can we do it better? How can we keep it simple? That type of thing.
Because that's the most likely be hardwired, as we talk about. When it's simple, everybody knows what their piece is, and it's copyable.
Right.
So those things that we practice, then we can actually use, as we've done with our drills. So I know we talked about I guess I think of as a layperson, the more I've learned about this, the better I feel about just knowing that KRMC is prepared.
We are, and we have minimum standards to keep extra food and water, on the
hand.
campus, so that we have that type of thing, and we have backup power. So we've looked at all of those things, alternates,
That's the thing is we become more and more modernized in our society, and that's why people don't have normally a 2-week supply of food. We've gotten spoiled, used to being able to just stop at the grocery store on our way home to pick up whatever we need, and we're so dependent on electricity and power, and don't think about if that went away.
What do you do?
What do you do
Right,
instead?
exactly.
Oh, that's a lot of things to think about. So do you have a little checklist that you keep working off of?
Sort of. I just,
Yeah.
Well, it's a good thing is I am old, and so if all the power goes out, I know how to communicate with pen and pencil as opposed to texting.
Yeah.
So if all the cell towers go down, I know how to work it.
You can still write a
Well, in
hand
the
message.
80s, we didn't have that stuff, so
I
we
know,
did. We had
yeah.
pads. We'd send messengers with pads to communicate
Yep.
to each other throughout the facility. When they never let us use the elevators for fear that the power would go and we'd have people trapped in there, so people would run up and down the stairs with their little pads to communicate, as opposed to now where I just text you.
Yeah, God forbid our cell towers ever go down, right?
Right.
This generation behind us, I don't think they could even cope.
Right, because it is truly a world of communication today, instant communication.
Yes, it is.
So yes, we look at alternate things. If we can't do that, what can we do? So we look at the next thing. If this doesn't work, does that work? If that doesn't work, what else is out there? Who
Right.
can we call? And what do they know? Ham operators, huge thing.
Right, they're a big
Right, and we're
component.
and they haven't been real active, but they're getting active with our planning.
Great.
So we're looking at that as far as an alternate way to communicate with the outside world, because we are fairly isolated.
Right, right.
You know.
So if someone has questions, is there a number that they can call real quick before we end the show here?
Sure. If anybody has any questions, my direct line is 928-757-0647.
0647. Okay, so give Sue a call if you've got questions. We'll have another great guest on our show next week. Thanks for joining us today.